Tomorrow, there will be a new emergency number that anyone can call for mental health help. That number, 988.
It's going to replace the current number, which is a 10-digit national lifeline number. CBS 17's Darren Todd talked with mental health experts about this change.
Data shows that suicide is the 10th leading cause of death in the United States, and experts say that the new 988 number is easier to remember for those who really need the service.
There are millions of people across the country that struggle with mental health issues.
In 2019, more than 1,300 people died by suicide in the state of North Carolina. Saturday, 988 will become the new number across the country for the National Suicide Prevention Lifeline, replacing the current phone number of 1-800-273-TALK. Experts say this move to 988 is easier for many people to remember and could be the determining factor between life and death for some.
We also know that many individuals who don't get the help they need in a timely way may turn to things like harming themselves or harming others.
Congress recently established a 988 number as a simplified resource for individuals in crisis who need assistance. Each state has received federal funding to help with the transition.
We actually received a grant from the Substance Abuse and Mental Health Services Administration for about $3.3 million.
The funding is based on the number of calls each state gets. While final data for 2020 is not yet available, the preliminary numbers show more than 37,000 callers received crisis intervention help in North Carolina to prevent suicide deaths.
The move to the number to 988 represents is really our ability as a nation to say that we really want to provide individuals as much access to mental health help as possible.
Now, the state is using more than $120,000 of this funding to help with staffing and the launching of 988 tomorrow. In the studio, Darren Todd, CBS 17 News.